actually director emeritus. So as of a year ago, so we should say that.
Oh, director emeritus. Okay.
Good evening, and welcome to the Kathleen Hickey Endowed Lectureship, the first endowed lectureship housed at the School of Nursing at Columbia. The Kathleen Hickey Endowed Lectureship in the Science of Cardiovascular Care is the first endowed lectureship that honors a nurse scientist at Columbia University. It is very fitting that this lectureship is honoring Kathleen Hickey. Dr. Hickey served as professor of nursing at Columbia School of Nursing and co-director of the Precision and Symptom Self-Management Center. She has held a joint appointment in the Division of Cardiology and Electrophysiology as both a family and adult nurse practitioner. She was a Robert Wood Johnson Nurse Faculty Scholar. She contributed to key statements from the American Heart Association and held multiple leadership positions in the International Society for Nursing and Genetics. Kathleen devoted her career to conducting innovative research to improve cardiovascular health. Specifically, her interdisciplinary research and clinical practice focused on the areas of cardiogenetics, the clinical care and management of those with atrial and ventricular arrhythmias, and the prevention of sudden cardiac death. We are thrilled to have Dr. Hasan Garan as our inaugural speaker. Dr. Garan worked with Kathleen and was a close friend to her and her families. I will now turn this over to Dr. Jackie Taylor, Executive Director of the Center for Research on People of Color, who has the honor of overseeing this lectureship through her center. Jackie?
Thank you so much, Dean Frazier. It's truly an honor to steward this lectureship in honor of Kathleen, who was a wonderful scientist, wonderful person, and a great friend overall. She really, truly was family to many of us here, including myself and Dr. Garan and others here at the School of Nursing. We are so thrilled that you are all here to join us today to honor her and her memory. I want to say a special thank you to the family of Kathleen Hickey, who may be here today. I can't see your faces on the webinar, but I know I've spoken with Bill Hickey, her husband, and I know he plans on being on along with other members of her family, both here in the States and in Ireland. So thank you so much. I also want to give a big thank you to Dean Fraser and the school Hassan for supporting this effort to establish the first endowed lectureship in honoring Kathleen. Also, I want to thank the Division of Cardiology, who also helped tremendously in making this happen. I also want to thank the faculty members that helped to put this together, helped guide me through all the different steps to do this in honor for Kathleen. So we could not have done this without you, Suzanne Bakken and Dean Mundinger as well. So without further ado, I'm thrilled to be able to introduce Dr. Hasan Garan, who worked closely with Kathleen for many, many years. Dr. Hasan Garan served as the director from 2001 until 2021 and is now Director Emeritus of the Clinical Cardiac Electrophysiology program at Columbia University Medical Center and New York Presbyterian Hospital. He is a clinical cardiac electrophysiologist and a researcher in cardiac electrophysiology since its emergence as a young medical science approximately 40 years ago. During his tenure at the Mass General Hospital, where he was the co-director of the Cardiac Electrophysiology Laboratory, he developed a canine myocardial infarction model to investigate cardiac arrhythmia mechanisms. With support from the American Heart Association Established Investigator Award and later SCORE grant from NIH, he studied the underlying mechanisms of ischemic ventricular tachycardia in the animal laboratory, with important contributions to our understanding of this common post-infarction arrhythmia. Clinically, Dr. Garan's experience in the diagnosis, treatment, and management of cardiac arrhythmias spans the last 35 years. The cardiac electrophysiology department was among the first ones contributing to the development of implantable devices for prevention of sudden cardiac death due to malignant ventricular arrhythmias in patients with organic heart disease and genetically acquired channelopathies. The department's laboratory was also at the forefront of the investigation and treatment of supraventricular and ventricular tachycardias using the non-pharmacological techniques of catheter mapping and ablation. Starting in 2001, when he joined Columbia University Medical Center, he gradually built a very active, high-volume clinical cardiac electrophysiology service dedicated to the treatment of a wide spectrum of cardiac arrhythmias using the most advanced techniques. At Columbia, Dr. Garan continued his research in the investigation of the mechanisms and treatment techniques of cardiac arrhythmias in his research and in the investigation of mechanisms in the cardiac electrophysiology laboratory. His team has investigated the underlying mechanisms of the most common human arrhythmia, atrial fibrillation, and atypical atrial flutter by sophisticated techniques of signal analysis using data acquired in patients undergoing catheter mapping and ablation in the laboratory. They are collaborating with Columbia Bioengineering Department to use the novel technique of mapping myocardial activation sequence by electromechanical wave imaging for non-invasive identification of the site of origin of cardiac arrhythmias. The department's translational science laboratory, in collaboration with the molecular cardiology department, is investigating the mechanisms of atrial fibrillation in genetically altered mouse models. Their next goal is to establish a comprehensive clinical cardiogenetics electrophysiology section for diagnosis and treatment of inherited cardiac arrhythmias. Please join me in welcoming Dr. Hasan Garan.
Can everybody hear me?
Yes.
Thank you very, very much for that wonderful introduction and for your kind words. We come together today in remembrance of a remarkable woman, Kathleen Hickey, to celebrate her life and lifelong achievements. A little over 3 years ago, while at the peak of her illustrious career, Professor Kathleen Hickey became seriously ill, and after a long battle with a brain tumor, died last year peacefully in the company of her loving family. Thank you. That's okay for this first slide. I feel honored and privileged to give this talk about Kathleen. There are many, can we go back to the first slide, please? I feel honored and privileged to give this talk about Kathleen. There are many, many vivid memories of Kathleen in my mind, most of them joyful, a few of them sad. And I consider this gathering a celebration of her life. Most importantly, this is an occasion to remember and celebrate the academic achievements of one of the most smart and decent persons I've ever known, worked with, and loved. My dear colleague, Kathleen. Improvising is a gift, unfortunately not bestowed upon me, so please bear with me as I read these words I have written for Kathleen on this occasion. Little over 20 years ago, I started my career at Columbia University Medical Center. I had come along without a team, without assistance, without any other soul accompanying me. Naturally, I was a little anxious about fitting in the traditional Columbia culture. Little did I know that I was destined to meet soon a marvelous and gentle envoy from fair course of life who would help me and guide me during all my endeavors in this institution for years to come and make my professional life as fruitful, efficient, and pleasant as could be. This was Kathleen, and she knew Columbia culture quite well. She welcomed me, and from the get-go, we established a working relationship that was going to endure and strengthen for years to come. For the following 18 years, I shared medicine, science, patient care, compassion, respect, and friendship with Kathleen. Her intellectual insight, her organizational and leadership skills were unparalleled. She always gave me good advice that I could depend on, always steered me in the right direction. Trying to be a caregiver in an ethnic community previously unfamiliar to me, Kathleen also was a great help and taught me to have respect for the complexity of life in this medical community without unduly complicating my own. We worked hard, and while we took our patients and our research very seriously, we did not take ourselves very seriously, maintaining a perspective and ease that allowed us to share a great deal of laughter as we went along. Kathleen's career was a steady rise in academic nursing all the way to full professorship at Columbia University School of Nursing. Her inquisitive mind was always thinking of novel projects that focused on clearly defined specific aims. Everybody who's listening to this talk knows Kathleen's immeasurable contributions to Columbia medical community, to the care of the ethnic community we serve, to our cardiac electrophysiology department, to Columbia School of Nursing, and to the medical education of young nurses and young physicians. I do not have time to give you all the details, many of which you already know. However, certain accomplishments in her life stand quite tall, and it is fitting that for this occasion, they should be described. I will summarize Kathleen's professional accomplishments and contributions to medical science in 3 broad categories. Next slide, please. In order to understand Kathleen's formative years at Columbia, we should start with a short history of cardiac electrophysiology. By 1950s, the giant clinicians and researchers had already described the electrocardiography of cardiac arrhythmias. clinical cardiac electrophysiology had not been born. Next slide, please. Research, cardiac electrophysiology was then a research tool. And if you wanted to be trained, there were only few training centers in the world you could go to. And certainly Columbia University Medical Center under Brian Huffman was one of them. The man to your left, Weidman, was the first man who recorded the first action potential ever from a myocardial cell. Dr. Brian Huffman had further advanced and described the action potentials in different tissues in the in the heart. And Dr. Gordon Moe was another giant who did a lot of research in the basic mechanisms of atrial arrhythmias, and especially atrial fibrillation. Next slide, please. You can see in this publication by Dr. Brian Huffman the description of different action potentials that are recorded from different sections of the cardiac tissue. Even today, his legacy and his tradition can be felt in the research labs across the street in the Columbia Presbyterian Hospital. Next slide, please. In the years to follow, there was clinical cardiac electrophysiology was born. And for this, we have to thank a couple of individuals. Next slide, please. One of them in Europe, in Amsterdam, Dr. Dirk Dürer, and the other one, the unsung hero, Anthony D'Amato in Staten Island here in New York, that single-handedly trained an entire first generation of clinical cardiac electrophysiologists. Next slide, please. This was a great effort to understand the underlying pathophysiology of cardiac arrhythmias by doing cardiac electrophysiology studies in the electrophysiology lab and define the mechanisms very precisely. But unfortunately, for treatment, we had very little. We had anti-arrhythmic drugs that were given to patients to suppress their cardiac arrhythmias after their arrhythmias have been documented. We live our life as doctors as primum non nocere, the dictum that I think will survive to infinity. However, of course, Hippocrates was a Greek and didn't speak Latin and certainly did not say primum non nocere. The closest remark in his corpus is one from Epidemics by Hippocrates, something like, the doctor should make every effort to be helpful and try not to hurt the patient. In any case, the hard lesson learned by giving these antiarrhythmic drugs to patients were proven by carefully done studies in late 80s. Next slide, please. And Columbia Center played a pivotal role in these studies. You can see in this very old, very well-known slide, the harm potential for giving certain antiarrhythmic drugs to patients with organic heart disease. Rather than helping them by suppressing their ventricular arrhythmias, they are harmful and diminish survival. Next slide, please. In 1992, when Kathleen was just starting her long career at Columbia University Medical Center, clinical cardiac electrophysiology was still a young science, but was rapidly progressing in the direction of non-pharmacologic arrhythmia therapies. Many of the guidelines we still use in clinical cardiac electrophysiology for preventing of sudden cardiac death, even today, are based on the results from foundational large-scale multi-center trials, mostly conducted in the 1990s. Again, Columbia Cardiology Department was an important participating center in these trials. Two multi-center trials that you see on this slide, AVID trial and MUST trial, had somewhat unintentionally suggested the superiority of implantable defibrillators over antiarrhythmic drugs in protecting the high-risk patients against malignant ventricular arrhythmias. Later, next slide, please, later probably conducted randomized trials such as SCUD-HEFT and MADED trials, next slide please, proved the efficacy of defibrillators in protecting high-risk patients against sudden cardiac death in coronary artery disease also in patients with congestive heart failure. The reason I'm showing you these results is that during the first part of her professional life, Kathleen acquired her seminal education in clinical cardiac research from giant clinical investigators in their field, like Dr. Thom Bigger of Columbia University. Next slide, please. This period dates back to years prior to my joining Columbia University faculty, but based on what I found out later, in 3 of these trials, Kathleen played a pivotal role in recruitment, data collection, organization, and quality control at Columbia site. During these years, Kathleen honed her clinical skills in recruitment for clinical trials in underserved communities, skills that will help her future investigations in the years to come. She was the co-author on several publications describing the outcomes of these trials. Kathleen's own subgroup analysis about the beneficial role of beta blockers in the MUST trial cohort resulted in a first author abstract presented and published in Circulation, the premier cardiology journal in 1999. This was later followed, next slide please, by a first author manuscript by Kathleen based on analysis of data from AVID trial published in American Heart Journal in 2001. So by the time I joined Columbia in 2001, Kathleen was well on her way to becoming a sophisticated, established clinical investigator. As a result of her impressive achievements as a researcher, Kathleen became the first recipient of Columbia University School of Nursing's prestigious Outstanding Young Investigator Award in 2007. In 2012, she was inducted as a Fellow of American Heart Association. The second area of research I wanted to talk about is Kathleen's contribution to the field of cardiogenetics, both locally at Columbia University Medical Center and also nationally. After I started working closely with Kathleen, we got into the habit of getting together from time to time for informal brainstorming sessions. What I valued most in our relationship, other than mutual respect, was Kathleen's enthusiasm. Enthusiasm can take 1,000 forms, but it is of one basic nature, and it is contagious. Having a coworker like her certainly kept my enthusiasm soaring. I had a growing concern that the field of genetics was playing a growing role in clinical medicine. And many of the cardiac arrhythmias that we describe and we observe are the result of genetically acquired arrhythmias. Next slide, please. I don't think you have to go to medical school to realize that something terribly is going wrong on the right side of this slide. And many such arrhythmias that we observe in clinical cardiology are the result of inherited problems. Next slide, please. Here you can see a short list on the left-hand side of organic heart disease that can be genetically inherited, resulting in premature lethal arrhythmias, terminating fruitful lives in youth or in middle age. On the right-hand side, you also see specific syndromes that can be inherited, and these are also arrhythmias that can cause sudden cardiac death and premature demise. Next slide, please. Here's a growing list of mutations. Every time I check this list, there are a few more added. It's like the 1960s in nuclear physics, where there was a jungle of little particles invented in the bubble chambers. And now we are having a jungle of mutations, all of which can result in electrocardiographic changes and result in life-threatening arrhythmias. And meanwhile, next slide, please, the gap between basic science and bedside was increasing. And this gap had to be closed and narrowed, and we need we needed interpreters, smart clinicians who understand the science as well as the caregiving on the clinical side. Here you can see a cartoon of a potassium, one of the several potassium channels in the heart, and multiple mutations described by the blue dots that you see in the long and complex molecular structure. Next slide, please. And such changes, such mutations, not all, but most of them, can cause lethal arrhythmias like this, long QT prolongation and torsade point. Next slide, please. And here is a organic heart disease, hypertrophic cardiomyopathy that is genetically inherited. And due to changes, especially the fibrosis, the interstitial collagen that you see, that is deposited due to the abnormality in the architecture of the myocardial fabric. These fibrosis, areas of fibrosis, cause lethal arrhythmias and sudden cardiac death. Next slide, please. And as with the channels, there's an increasing list, much longer than what I'm showing you now, of mutations in different sarcomatic and other proteins that can cause lethal arrhythmias in these patients. During one of our informal sessions, I mentioned to Kathleen that the rapidly expanding area of inherited cardiac arrhythmias required a focused clinical endeavor and a clinic dedicated to the diagnosis and treatment of these arrhythmias, a dimension not yet fully developed at that time in Columbia University Medical Center. Little did I know how soon Kathleen would get behind this project and start moving forward. Before long, Kathleen and I were crossing the Atlantic Ocean on our way to Amsterdam, Netherlands, to visit Professor Arthur Wilde's cardiogenetics clinic. Next slide, please. Arguably the greatest in Europe, if not in the world. Dr. Wilde had paid visits to Columbia Medical Center previously for lectures and conferences. Kathleen rapidly established ties with Dr. Wilde's research team. When we returned to New York, we went to work. Kathleen's Robert Wood Johnson Nurse Faculty Scholar research experience allowed her to work with individuals with many genetically based forms of arrhythmias. With the help of Dr. Wilde's frequent visits to Columbia, and with the valuable input from Dr. Murdoch Riley of Columbia Precision Medicine Department, we established our cardiogenetics clinic. Later, we were also fortunate enough to have Dr. Arthur Wilde to come to New York and do a 7-month sabbatical at Columbia, during which he made invaluable contributions to our clinic as a mentor and educator. During this time, Kathleen played a significant role and also became close members, close friends and colleagues with Dr. Wilde and his associates. Next slide, please. Kathleen was invited to join the Cardiovascular Nursing Council and Functional Genomic Committee of the American Heart Association. She served as the president of the International Society on Nursing and Genetics from 2012 to 2013. In 2014, Kathleen received the International Society of Nursing Genetics Founders Research Award. She presented her work at the Institute of Medicine on using genomic evidence for patient decision-making in 2015, and on the intersection of health literacy and precision medicine in 2016. Her academic endeavors in cardiovascular genetics also resulted in 3 first author papers, including one that you see on the effect of cardiac genetic testing on psychological well-being and illness perceptions, published in Heart and Lung, a very prestigious cardiovascular journal. She contributed to developing the NIH genomic roadmap for future, and she was engaged in local precision medicine efforts at Columbia University. Next slide, please. Finally, and very notably, she served as the co-chair of the genetic expert panel for the American Academy of Nursing, as well as in leadership roles in cardiovascular nursing and functional genomic councils within the American Heart Association. The third category of Kathleen's major contributions to clinical medicine excuse me, and nursing is her investigation and integrated approach to cardiac arrhythmia management using multidisciplinary team approach, especially in patient populations with atrial fibrillation. Next slide, please. I need not tell this audience how common a problem atrial fibrillation is, especially in the elderly, and how costly its morbidity has become. Kathleen had more than 2 decades of clinical experience in atrial fibrillation, hypertension, stroke, and chronic cardiovascular disease. During most of her nursing careers as a researcher and nurse practitioner at Columbia University, Kathleen focused on caring for and conducting research in an underserved minority Latino population with chronic cardiovascular conditions. Next slide, please. She understood the importance of future role of precision medicine and e-learning. Most importantly, she had the foresight to recognize the importance of motivating patients by engaging them and having them participate actively in their own health for improved outcomes. She realized the importance of self-detection of cardiac arrhythmias to clearly define their association with symptoms in evaluating the overall cardiac outcomes and quality of life. Cardiac arrhythmias we induce in the artificial atmosphere of the cardiac electrophysiology laboratory are frequently a poor substitute for the naturally occurring arrhythmias. This had been realized decades ago. Next slide, please. And technology, next slide. And technology had become available for ambulatory monitoring of cardiac rhythm. This is the inventor of the ambulatory ECG. And as you can see, the Model T of this is quite bulky and would be unacceptable today. Next slide, please. Fortunately, with the advance of technology, we've come a long way and we don't have to resort to those cumbersome techniques. Kathleen was the PI of an R03 grant that focused on cardiac self-management via mHealth to improve arrhythmia detection, the relationship of ECG findings to simple clusters, and the impact on quality of life in minorities. This research focused on utilizing cardiac monitoring in a minority Latino population with underlying hypertension, diabetes, heart failure, and obesity, placing them at risk for adverse cardiac outcomes. She disseminated her findings at national and international meetings in a variety of peer-reviewed publications. Next slide, please. Most recently, Kathleen was the PI of an R01 grant entitled iPhone, helping evaluate atrial fibrillation rhythm through technology, so-called iHeart. This extensive study had the overreaching goal of using advances in mHealth technology to better detect recurrent atrial fibrillation, a major independent and often undetected risk factor for adverse outcomes. The specific goal of this study was to determine whether daily monitoring with a smartphone intervention could improve AF detection and allow more timely initiation of medical therapies and treatments, and could potentially change the existing Medicare guidelines to include mHealth initiatives in the future. She was responsible for the day-to-day operations of the grant and ensured the aims were achieved and disseminated in a timely fashion. Next slide, please. Even after Kathleen became ill, thanks to the invaluable efforts of Dr. Suzanne Bakken, professor of bioinformatics at Columbia School of Nursing, the results from this research continue to be published in peer-reviewed journals. Before I finish, I would like to mention a few words about Kathleen's contributions to the interdisciplinary research in the Department of Medicine at Columbia University Medical Center. This was most notable in the collaborations between different subsections of cardiology department. Here again, she demonstrated great enthusiasm and drive in networking with the investigators in other departments, sharing data, critically analyzing these data, and coming up with original projects. Next slide, please. This is an example of such interdepartmental collaboration among the cardiology, cardiac electrophysiology, the heart failure, and the cardiothoracic surgery departments, a highly original first-order publication by Kathleen. Last but not least, I would like to point out Kathleen's contribution to nursing and medical education. She was a dedicated teacher and mentor to many young nurses and young physicians and clinical investigators. She also served as the career development mentor to nurses and researchers with full commitment for providing the resources needed to ensure the goals set forth for successful careers and is inspiring the next generation nursing scholars to seek advanced certification as part of their career development. Kathleen was the recipient of Glenda Garvey Teaching Academy Award. As for myself, above all, Kathleen was a dear friend, and our friendship extended beyond our professional relationship. Next slide, please. I have become friends with Kathleen's lovely family, her husband, Bill. Next slide, please. And her two daughters, Caitlin and Megan. Bright young women with impressive achievements of their own. Kathleen was so proud of them, always talked about them. Now that I look back and reminisce, what I valued most in our relationship, even more than mutual respect, was Kathleen's warmth and enthusiasm. Kathleen was thoroughly involved and enthusiastic about what she deeply cared for, without reservation and plainly without apology. Not only professionally, but also outside medicine, we shared many magic moments with Kathleen. I remember one such occasion vividly during our travel in southern England, when we stood side by side in Salisbury Cathedral, admiring the best kept one of the 4 original copies of Magna Carta. Kathleen also effortlessly transferred her enthusiasm to the people she was close to. To quote the bard, Shakespeare, and taking a slight liberty with his immortal words, enthusiasm is twice blessed. It blesses her that gives and him that receives. And the person who receives it discovers new wonders, unsuspected truths in the things she or he truly cares for. Kathleen, your friendship was a great gift for me. What worldly achievement, what mundane pleasure, however delicate, can be compared with years of friendship and shared experience and common purpose, which surely, if any such mirror exists anywhere in the universe, reflects the universe's meaning and strengthens the certainty that it has won. I will live the rest of my life remembering this gift and forever keep you in my memory and in my heart. Thank you.
Thank you so much, Dr. Garan, for just, giving us more insight into your experiences with Kathleen. I think we all, can feel the love that you have for her and all of the, warmth and how the love that we felt when we were always around Kathleen. I see a lot of comments in the chat, more of comments and how Kathleen had this effect on people, to everyone that she met. I truly miss her. I miss rooming with her at American Heart Association and at the ISONG conferences and American Academy of Nursing. I see that there's representation from all over, not only the nursing community, but cardiology, Columbia, American Heart Association. I see people from NINR are on the webinar as well. I just want to thank everyone again for, logging on and being a part of this in memorial to Kathleen. We will hold this lectureship annually in perpetuity in honor of Kathleen. Her memory will live on forever here at Columbia School of Nursing. We will hold it in February each year, Heart Month, to represent the work that she did in cardiovascular care. If we have any questions, please put them in the chat. I see a lot of comments. I can read some of these. I see that Kathleen's sister is here and she's she says that, she's thankful that we did this and she misses Kathleen and thinks about her every day. Dr. Murdoch Riley, he talks about how she is an unbelievable colleague, an amazing nurse, caregiver, and researcher. I know I had the pleasure of spending a lot of time with Kathleen, and she always talked about her daughters. I'm always happy to talk with her husband, Bill, and get an update on her daughters. I feel like they're my family now because we would talk about our kids so much. And, I'm so glad that, both of them have graduated from Columbia, and Caitlin is in her first year of law school, and Megan is working in Midtown. And I'm just so happy that the girls are thriving, and that this is something that we can do to let them know that their mother was appreciated, loved, and that we recognize all of her significant contributions to nursing, medicine, and healthcare in general. Do we have, Dr. Fraser, did you have your hand up on the, I thought I saw your hand.
I'm so sorry. I accidentally put it up, but I agree with everything you say. Dr. Garan, thank you. Thank you. Thank you for such a wonderful presentation. And she will always be remembered and always be missed. And it was an honor to have you first because you knew her so well. And we know that that came from your heart. So thank you.
I'm so privileged to be able to do this. And thank you from the bottom of my heart for asking me to do it.
And, and I think everyone that came, I see, people from Robert Wood Johnson, Nurse Faculty Scholars, Jackie Campbell is on. I see Lois Tully from NINR, Yvette Connolly from ISONG, and many of our genomics colleagues and nursing colleagues from all across the country. So again, I want to thank everyone for taking the time to honor Kathleen. Next year, hopefully we will have this in person and have a proper classy affair in honor of our friend and colleague, Kathleen. But we do appreciate you all coming and being on with us. I see a lot of accolades here for Kathleen. And I'm trying to see if we have any questions before we close out here. So I don't see any additional questions. I'll just thank everyone for coming, and we look forward to hosting you all again next year. And hopefully this will be in person. If you can take a few moments for the attendees to please fill out our brief survey here in the chat. We'd be very thankful for that so that we'll know what your thoughts are regarding this lectureship and how we can always make it a shining star to Kathleen Hickey. So thank you again, Dr. Garan, for all your wonderful, kind words and helping us to remember our beloved colleague, Dr. Kathleen Hickey.
Thank you.
And thank you for everyone that attend. Have a great evening.